everybody. I'm Paula Ebben. Welcome to Family Focus and our three-part series on maternal health from conception to 1 year. The United States has one of the worst maternal death rates among developed nations, and the numbers are only getting worse. According to a new analysis by the CDC, roughly 60% of pregnancy-related deaths could be prevented. So, to get some advice for women on what to watch out for is our own Dr. Mallika Marshall. And Doctor, very upsetting actually in this day and age. First of all, tell us more about the recent report from the CDC. Why?
It's the United States.
Yeah.
And these numbers are just not getting any better. It's so awful. So they actually found that a third of deaths occur during pregnancy, a third of deaths occur at delivery or within that first week, and a third of deaths actually occur a week to 1 year later after the baby has come out.
That's incredible. And heart disease and stroke?
That's right. So heart disease and stroke overall were the leading causes of death, but there are other things, other complications that can occur really at any stage during pregnancy or afterwards.
So everybody thinks the clock begins, everything gets started as soon as you have, you know, the plus sign turn blue or that positive pregnancy test. But there are actually some things you can do before, if you know you're going to be getting pregnant. There are things that you can do to help with your health.
That's right. So if you're even thinking about getting pregnant, these are the things you should do to sort of get your little duckies in a row, so to speak, right? So the first thing you want to do is actually check in with your doctor. And that is to make sure that you have any underlying medical conditions that you have, that they're being addressed, whether it's thyroid disease or high blood pressure, for example. Any mental health issues that you might have are being addressed. You can discuss medications that might not be safe to take while pregnant. And then you need to update your vaccine. So are you up to date on your tetanus? Are you up to date on your measles? Maybe it's time to get a flu shot, things like that.
Might want to take an iron supplement, things like that.
Exactly.
Right? What about substances?
Okay, so you want to stop smoking before you get pregnant, and that counts for both you and your partner. You want to stop drinking alcohol before you get pregnant, and
Which
avoid...
is one people don't think about.
No, they don't. And a lot of people think, oh, as soon as I get that positive pregnancy test, then I'll stop. Well, sometimes you don't know until you're 6, 8, sometimes 10 weeks into the pregnancy, right? So avoid any drugs. That includes marijuana. Cut down on caffeine. You don't have to eliminate it altogether, but if you're a big coffee drinker, you need to start reducing it. And avoid environmental toxins. So things like pesticides and chemicals, and get someone else to change the cat litter box, because there are parasites that can actually come with cat waste.
Some people stop dyeing their hair, right, during a pregnancy.
Absolutely.
What about dietary suggestions?
Okay, so number one, you know, we always talk about pregnant women taking a prenatal vitamin that needs to have 400 micrograms of folic acid in it. Good idea to start taking it before you get pregnant, because it's those early few months when we start to really worry about neural tube defects. Eat a healthy diet with fruit and veggies and lots of whole grains. And if you're overweight, it's a good idea to try to shed some pounds before you get pregnant, so that you're not worried about it during the pregnancy.
In terms of the prenatal vitamin, I can say from personal experience, once you are pregnant, they can make you a little nauseous.
They can.
So you probably want to take it before you're going to start feeling like that.
And I used to take it at night to try to help.
That's true. Help with morning sickness.
Yeah.
Thank you so much.
You're welcome.
And stay tuned for the next part in our series on maternal health. We'll tackle staying healthy while you're pregnant with Dr. Mallika Marshall.